Adequacy of eyelid closure, basically a cranial nerve 7 type check, right? We're going to check for obstruction of the nasolacrimal duct, and then we're going to use some lighting, direct, oblique, tangential, okay? So here, go ahead and close your eyes. You're going to feel a little resistance. You keep them closed. But you close them fine, and she can hold against resistance, right? So that's the eyelid closure. Next, check for obstruction of the nasolacrimal duct. What would I do? Palpate what?
You said
Oh,
lacrimal,
this guy.
didn't you?
Nasolacrimal duct, not the lacrimal gland.
I don't
So,
know.
look, the glands here are superior laterally, right? Tears flow across, they drain into those puncta medially, and then there's a sac here. Nasolacrimal duct runs down. Where does it empty? Inferior meatus, underneath the inferior concha turbinate, right? So if there's obstruction in this duct, fluid builds up in that sac. Does that make sense? So if I put a little pressure here over the sac, it pushes the fluid back through the puncta, right? And you get regurgitation into that. So I'll have the patient look up. You press right there. Does that make sense? Mm-hmm. So there could be some sort of scar tissue, tumor, different things that could obstruct, right? There could be infection of the nasolacrimal sac. What do we call that? I've asked this about. You know what's bad? I say I ask this a lot, but I've had a bunch of different labs. It hasn't all been to you guys. So what do we call that infection?
Itis.
Dacrocystitis. You got dacro and itis. Good. Dacrocystitis, okay? That'll do it also. Does that make sense? So we're looking for obstruction. Different things can cause that. Now, after that, we're going to move into our lighting. So come around here so you can see this. We're going to use direct lighting. Direct lighting means I'm going to hold this about, so that there's no near reaction, right? Just outside of the near reaction zone. And I'm going to have her look directly, direct lighting into the light. Look directly into the light. Can everyone see that reflection of the light right in her pupil? Mm-hmm. Where is it located? Come around so you can see it. Dusty, you get over here so you can see this. All right. You see that? Where is it located in her pupil? Basically right in the center. It can be maybe just a hair nasal of center, but largely right in the center, okay? That's normal. Now, what do we call it if she's looking straight ahead, focusing on something and one of the eyes wanders? Strabismus, right? You can have, you guys have seen someone that has an esotropia or a cross-eyed, right? And you can see it. Sometimes they're very, very slight, right? And you may not see it just looking at them, but when we look here, if that light's not in the center of the pupil, we know that eye has deviated some. Does that make sense? So, if we look at this middle set of eyes, is the right eye normal? And this is called a corneal reflection, by the way, the light. So that's a corneal reflection. That's what we saw in her with direct lighting, right? Is the corneal reflection centered in the right eye?
Yes.
Is it centered in the left eye?
No.
What's the problem in the left eye? Inward one, esotropia. So this eye, look, this eye is deviated inward, so it makes the light look like it's on the lateral aspect, right? How about here, this eye, is it the right or left eye the problem? The right. What's the problem? Hyper. So it's here, but it's moved up, so that light appears on the bottom. Does that make sense? So, as we perform direct lighting, the first thing we're looking for is any small tropias, right? The other thing we want to look for is ptosis. What's ptosis mean? Drooping of what? Eyelid. What should the normal distance from this corneal reflection to the upper lid margin be? Should be 4 to 4.5 millimeters, right? So again, on our patient here, direct lighting, we can look at that reflection and look at the distance to the upper lid margin, right? And it should be 4 to 4.5 millimeters. Okay? And hers is normal. So that lid really should lie just on the top of the iris, okay? If we see sclera there, particularly if they're looking down, we have lid lack, right? Sign of proptosis if it's bilateral, exophthalmos. True? Okay, so that's direct. Then we use tangential. Now, when I shine this across her eye, you see how both sides of the iris light up? Right, the whole thing is lit up. That's normal. If she had acute closed angle glaucoma, what happens to the iris and that?
or something, right?
So what happens to the iris?
Medial shadow.
Oh,
Yeah, you
bulges,
get a medial
doesn't it?
shadow, so it
Oh.
bulges. So if I'm shining the light from left to right, lateral to medial, let's say lateral to medial, right? Lateral to medial, and it bulges out here, then I get a shadow cast across that medial side. So a glaucoma, acute closed angle glaucoma, right? Then we have oblique lighting. What am I using the oblique lighting for? Anyone remember?
Oculomotor and optic nerve.
Well, not yet. First, we're just observation. We will do that in a minute with the light. So you're correct. Light reflects in a minute. But here I'm looking at the pupil itself, right? Making sure that it doesn't look gray or hazy. If I shine here and inside, like deep inside the pupil, it looks gray. What's that a common indication of?
Old age.
Well, what might
But in
happen
children,
with
it's
age?
something, I can't remember.
What's common, what is clouding or cataracts, right?
Cataracts, yeah.
You can have congenital cataracts, you can be born with it, right? Or it can occur with age. The other thing, what if I do this and there's gray, but it's not, it's superficial, it's over the pupil, but also the iris? What do we think's causing that then? What covers the pupil and iris? Cornea, so that's scarring of the cornea. Does that make sense? Corneal abrasion. All right, now, so what we're gonna do is we're gonna get in our groups again. You'll check adequacy of closure, check for obstruction of the nasolacrimal duct, and then perform direct, tangential, and oblique lighting. And in here, we've seen cataracts in a couple people, so take a look at it and see if it looks black when you shine that light in or if it's cloudy or gray.
Can you demonstrate tangential and oblique lighting on her right side, please?
Yeah. So, again here, what type of lighting is this? And you see, I'll shine it tangentially and I'll look around to make sure it's lit up, right? And then here, oblique. And Dr. DeMack makes a good point. Why does she, because you always do this bilaterally, right? Direct. You're
This is
just-
more so for the video,
Makes
but
sense? Always
this
do
is for you.
bilaterally. Thank you. All right, go ahead and